trunk side bending, right? If you support the leg, side bend the trunk. If you lift your hip, that's hip hike, that is collateral lumborum as well. What is the position against the gravity? And with gravity, it's kind of confusing. That needs more than a little bit of clinical skills. So you need to be more experienced to test that. Slide the patient at the heel off the table, and you hold one leg slightly out right there. Can you hike your head right here? Good. You're good. You're doing that very well. Good again. Right again. Good. Right again. That's good. All right. So that you apply like some resistance, and that may be grade 3, some resistance. And then you increase that resistance a little more with 4 and grade 5. Go, grade 5. So moderate and maximum resistance. That again depends on the clinical experience how much that you do. And I will not do grade 2 or 1 because of the thickness, right? We avoid that not to do it. Now because you cannot really palpate that it's very deep to palpate, and to pull that and to palpate here is not really so. Just ignore 2, 1, and 0 for that test. All what we need is to check in the lumbar and the quadratus lumborum working fine or not. So to put that there, and now hold it again, good. And do again one more time. And good. So that's grade 3, 4, and 5. Any question about that? For now it's good. And then when we come back again on the lumbar spine, next semester we'll do some more endurance to the side bending and how you train that, how you examine it. You doing good? What's your name? Good. All right, good. And take you one more time. I tend to ask the patient to take that gum out, especially when you put them in a supine position, right? So, and give it to him. You remember the rule of the arm position for the grade. If the arms, and now I'm going for trunk flexion. For the trunk flexion, if the arms extended beside, grade 3. If it's across the chest, 4. If it's behind the head, it's 5. Easy? Right. For flexion, that I will ask the patient to keep your leg on the ground, raise your leg. I want you to raise your shoulders and clear all the way down to your scapula. So you need the inferior angle of the scapula to be out of the table, That is grade 3. Try again. Hold it. And go down. Good. That's great. 3. She's able to, so cross your arm and do that again. She's able to clear that right there and go down. Grade 5. Up. She's good. All right, that's grade 5. If she's not able to, are you concentrating? She's not able to, you're going to go down to grade 2, right? Grade 2, partial range, try again. She's just clearing the head, not able to clear the scapula of the table, but I see the muscle contraction, and that's grade 2, partial range. All right? Grade 1, try again. Grade 1, she's trying, I feel muscle contraction of the abdominal, but is not producing any motion.
Why don't you bend the legs?
Yeah, you bend the legs because
Just for
grade 1. Actually, the grade 2 may bend the leg as well. Okay, good. Good. Okay. All right, there are some other gradings for that 2, 1, and 0 for the flexion, and we call that the sequence of the of grading. The sequence of grading on that flexion is different. So, and because most of the patient, I would put 65% of your patients coming for low back pain problems, that would be the main issue that we work on, abdominal muscles, core muscles. But they might have strong back muscles because of it's anti-gravity muscles, postural muscles, the muscles of the back is always okay, but they might have weakness of the abdominal, weakness on that muscle division. So grade 4, 5, you might not see it in your patient at all. Or few of them you may have that grade 4, 5. Most of them they will be 3 and below, especially for the flexion. So I will come to the patient and then try again straight your arm. The sequence number 1. I tested grade 3 and she's not able to. So I'm going down 2, 1 and 0. 2, 1 and 0. Sequence 1, patient bend both knees. When you come close to the patient, you are here ready to help. So my hand will be under right there. Can you lift up for me? Lift up. She's lifting partial range. And during that is grade 2. Grade 2. Alright? Grade 1, I'm going to do my hand right there. Now I'm going to help her to get up a little bit. And my hand is right here. Can you go down? Alright? So now she's doing muscle contraction and is okay. That's grade 1 as well. There's another way for grade 1. She's able to do that. You're going to bring the patient passively. So let me get my hand. I'm going to bring her to this right there, to this position, my hand right here. And then you get your face out of the patient's face. Don't do that. Because you're going to ask the patient to cough. All right, and if you feel a little bit of contraction and some of contraction of the abdominal muscles, that's grade 1. Still, it's able to produce that. Or if she's able to cough at the first place, the coughing itself is produced by the abdominal muscles. So that's grade 1. If there is no, of the patient is not able to cough, that's grade 0. 0 completely. You might, the patient will not